The Chinese government says it is stepping up efforts to deal with the deadly coronavirus as it continues to spread. At least 132 people are dead and almost 6,000 cases have been confirmed in mainland China as the Wuhan coronavirus spreads across Asia and the rest of the world. Nearly 60 million people are under partial or full lockdown in Chinese cities. Chinese health officials who have been addressing journalists in Beijing say the situation is not out of control. They outline measures being taken.
Maintain close communication with the WHO. I myself have had phone calls with the WHO Director General to report the development of the disease and our prevention control work. We have shared the full genome sequence of the new coronavirus with the WHO and without delay. We have also had consultation and exchanges with the WHO experts. We have invited WHO experts to Wuhan to check the situation on the ground and better know about the virus. We have closed relevant markets in a speedy manner, tightened control over illegal breeding, transportation, trading, and consumption of wildlife or wild animals. We have closed on a temporary basis airports, train stations, and other exit channels from Wuhan to prevent the spread of the virus. We have also coordinated the mobilization of Central Medical Reserve to distribute relevant materials to Wuhan. We have transported protection suits, masks, gloves, goggles, and other materials to Wuhan. The central government has earmarked 1 billion yuan of funds from the central budget to support the control and prevention work in Hubei. And we have also sent 7 medical teams of 900 doctors to Hubei and Wuhan, and the rotation teams are ready for departure. The military has also sent 450 military doctors and medical workers, and we also have 8 reserve teams of over 1,000 people ready for departure.
Wuhan, the Chinese city at the center of the deadly coronavirus disease outbreak, has now become globally popular as it is mentioned daily since the infection started. But how really is Wuhan like? Fred Smith, who has been there before, takes us a bit closer.
Wuhan is sometimes referred to as the Chicago of China because of its key role in domestic transportation. It is the capital and largest city in the Hubei province with a population of more than 11 million. Wuhan was briefly the capital of China in 1927. The city later served as the wartime capital of China in 1937 for 10 months during the Second Sino-Japanese War. Wuhan today is considered the political, economic, financial, commercial, cultural, and educational center of central China. It is a major transportation hub with dozens of railways, roads, and expressways passing through the city and connecting to other major cities. While Wuhan has been a traditional manufacturing hub for decades, it is also one of the areas promoting modern industrial changes in China. Wuhan consists of 3 national development zones, 4 scientific and technological development parks, over 350 research institutes, 1,656 high-tech enterprises, numerous enterprise incubators, and investments from 230 Fortune Global 500 firms. It produced GDP of $224 billion in 2018 alone. The city is also home to multiple notable institutes of higher education, but Wuhan is not new to disasters. The city has suffered flooding in the past, prompting the Chinese government to alleviate the plight of the people there.
Fred Smith with that report. There are more than 80 confirmed cases outside of China, including at least 5 in the United States of America, Japan, and several other countries that are now flying out their citizens of Wuhan. Kenya and Ivory Coast are also investigating suspected cases. 4 Kenyan students who returned from the epicenter of the coronavirus outbreak have been quarantined in a secluded area at the Jomo Kenyatta International Airport after showing symptoms of the deadly virus when they disembarked at the airport. The 4 students, according to airport and health officials, were running high temperatures and feverish. some of the symptoms of the virus that has already claimed dozens of lives, as I said. My colleague Latif Idrisu, who is attending a UN disaster risk reduction program in Kenya, gave us an update a while ago.
These 4 students, we are told by the Kenyan authorities, that have been in the epicenter of this outbreak of coronavirus, that is Wuhan, for the past couple of years, undertaking studies in various fields. The 2 landed at the Jomo Kenyatta International Airport on Tuesday, and after going through checks and scans at the Jomo Kenyatta International Airport, officials of the health sector here in Kenya and airport officials, after undertaking these 4 and other people through the protocol at the airport, came to a firm conclusion that they were showing signs of the deadly coronavirus. 2 signs, actually, we are told, came up. They were feverish, 1, and the second, they were running high temperatures. So the airport officials quickly moved them into a secluded area and then quarantined them. As we speak, there is no word as to whether or not all these 4, or even a single one of them, is confirmed to be carrying the coronavirus. We do not have that information. What we know is that these 4 Kenyans are currently being quarantined at the airport, that is the Jomo Kenyatta International Airport, where they are being taken through various tests and scans, apart from what was carried out at the Jomo Kenyatta International Airport proper, to ascertain whether indeed they are carrying the deadly coronavirus. Just to add that in Ethiopia, we also know that 1 person has been quarantined. He traveled from China to Ethiopia. He's been quarantined after also showing signs of or symptoms of the coronavirus. If you go to Cote d'Ivoire, we also have information that 1 person has been quarantined upon his return from China. So gradually, the coronavirus outbreak is assuming and has taken a global dimension. And the World Health Organization, we understand, are working closely with the Chinese authority and government to find a vaccine or cure for the deadly virus. We know that in China, 1 person has been cured at one of the facilities to bring some kind of hope to people who have contracted the virus going forward.
Well, health officials have also been speaking to this case this afternoon.
Today, the morning of 28th January 2020, the Ministry of Health was notified of a passenger who was aboard a flight KQ887 from Guangzhou in China, who upon a screening on arrival at Jomo Kenyatta International Airport was found to have a fever. I state at this point that a fever could be occasioned by any ailment, but the traveler reported he had not been in contact with a known case of novel coronavirus 2019, and he was immediately isolated in a temporary holding room at the airport. He was later transferred to the infectious disease unit in Kenyatta National Hospital for further investigation and admission. On examination, the suspected case was found to be in stable condition, with all vital signs within normal ranges. Following admission at the Kenyatta National Hospital, appropriate specimens have been collected for investigation at the National Influenza Center. Information available indicates that he left Wuhan City on the 20th of January 2020. He left for Nairobi through Guangzhou in China and via Bangkok, Thailand on 27 January 2020. and arrived this morning, as I've just indicated. The suspected case remains in the isolation facility at the hospital while investigations and laboratory tests are undertaken. So far, this remains only a suspected case. We wish to advise members of the public as follows. 1, the need to maintain basic hand and respiratory hygiene. 2, safe food practices need to be observed across the country. 3, avoid close contact with people suffering from acute respiratory infections. And finally, and in addition to this, anyone who is exhibiting symptoms of respiratory illness such as fever, coughing, difficulties in breathing, sneezing with a history of recent travel to China is advised to go to the nearest health facility for assessment and prompt management. The surveillance system remains on high alert at all the points of entry and health facilities, and screening is being conducted to all those from affected countries. Further, I want to assure you that the government shall continue sharing updates as and when it.
Kenyan health officials there. In Ghana, advisor to the President on Health and former Director General of the Ghana Health Service, Dr. Anthony Siasare, says Ghana will continue to work with the WHO to adopt ways of dealing with the deadly coronavirus disease in case it finds its way into the country.
We are giving to the President is that we will continuously to work together with the World Health Organization, and we are on the platform of them. We have a daily report, whatever is happening. And as you rightly said, we have increased the surveillance at the ports. Now, everybody who is disembarking in Kotoka International Airport or any of our ports fills a form. And we take a history and find out where you are coming from. And if you have any problem with fever, cough, or anything, then we take you somewhere and then test you. We are ready for anything which will happen. We are doing what we call case management, so that our frontline health workers will know that if anybody comes with the signs and symptoms of coronavirus, we will quickly take samples and then we contain, and then the most important thing is early detection, containment, prevention, and make sure that it doesn't spread to other places. That's exactly what we are doing. But what I will say is that everybody, if you have a patient or anybody in your house who is coughing or having any of the common flu, you should quickly take the patient to the hospital and the necessary things will be done. Or if you come in contact, don't come in contact with people who are having flu and all this thing. If you come in contact with them, do the normal wash. You clean your hands, wash it with soap and water and alcohol rub, and make sure that if you are coughing, you do what you call the cough etiquette. And then you don't cough out, you cover your nose and your mouth and cough. With this, I'm sure, because of our robust surveillance system in Ghana, we will continuously be on top of the issue and make sure that it doesn't cross our border. That's what we are going to do.
Talking of crossing borders, it already did into Kenya. Like I indicated this afternoon, we're live in both Kenya and Germany, which is also dealing with 4 suspected cases. Let's go to Kenya first, where Latif Idris is, from where he's joining us via Skype. Hello, Latif.
Hello, Gifty.
Latif, you do hear me, I believe, and I can see you. Tell us, what sort of reaction is this latest information generating in Kenya?
Yeah, so if you put one can simply see that cases that have been at the Jomo Kenyatta International Airport fully generated the capacity one would expect, considering how serious, deadly is. We know dozens of results of this coronavirus. You monitor the Kenyan media landscape. They treat it, but it didn't get that much traction as one would expect. There are a lot of issues in Kenya, and coronavirus seems to be one of the issues that is discussed on major news outlets in Kenya. That is the media landscape. Population, there isn't any panic or chaos on the citizenry.
Well, Latif, I'm struggling to hear you. It looks like we're having a problem with that connection there. But if I heard you clearly, you did indicate that we can safely say that this actually happened at the Jomo Kenyatta airport. We've gotten some updates as well from health officials there. They say this is a suspected case and they're continuing to monitor. What we also know is that the incubation period is about 10 days. And we also know now that it could actually be spread even during the incubation moment. So Latif Idris there joining us from Kenya.